Hi, I'm Dr. Matthew Goodman, and in this video I'm going to talk about how diaphragmatic breathing could be helpful for children with autism. So first, let's answer the question, what is diaphragmatic breathing? So most of us breathe into our bellies when we're young babies, and as we get older and as we accumulate stress in our bodies, we tend to breathe more into our chest and more shallow. And the difference can seem really subtle, but it can have a profound impact on both our physical and mental well-being. So diaphragmatic breathing uses the diaphragm muscle to push air in and out of the belly. On the inhale, our diaphragm muscle contracts, the belly expands, and then on the exhale, the diaphragm muscle relaxes and the belly contracts again. And breathing this way is really important, because when we breathe diaphragmatically, we're helping to activate the parasympathetic branch of the nervous system. So we have two different branches in the body. One is the parasympathetic, or the rest and digest. And then we also have the sympathetic nervous system, and that is called the fight or flight system. And oftentimes, especially in our modern culture where we're just bombarded with stressors, we're working a lot, or we have a lot of thoughts or anxiety going on, we can be stuck in that sympathetic nervous system, that fight or flight system. And it can be hard to turn that off and to switch on the parasympathetic. But diaphragmatic breathing is a really fast and effective way to do that. And the way that it does that is by recruiting what's called the vagus nerve. So this is a cranial nerve. It comes from the brainstem. It's connected to our heart. It's connected to our gut and other parts of our body. And it plays a vital role in regulating homeostasis and in helping to keep us in a healthy balance between parasympathetic and sympathetic activity. So when we breathe diaphragmatically, what happens is that on the inhale, the vagus will withdraw. This allows our heart rate to raise up. And then on the exhale, the vagus is stimulated. It goes on sort of like a brake. It slows down the heart rate, and that triggers parasympathetic activity. And as we continue to do that, we create these big oscillations in our heart rate. That's referred to as heart rate variability. And we're helping to stimulate and strengthen the parasympathetic response in the body. So how can this be helpful for children with autism, and what does it have to do with some of the core deficits in autism? So I think to better understand this, we can look through the lens of what's called the polyvagal theory. So this is something that was developed by Stephen Porges, and basically it goes like this. Dr. Porges proposed that our nervous system evolved in sort of three distinct phases, and this is reflected through these different pathways of the vagus nerve. So the first stage and the most primitive, this is called the dorsal vagus, or the unmyelinated vagal pathway, and this is involved in the freezing response. So this is a defense mechanism that we share with our reptilian ancestors. It goes all the way back to fish, right? So it's a defense mechanism, and we just sort of freeze up or feign death. And this is a way of hopefully escaping being eaten by a predator. Now, the next level, or kind of the next major evolutionary jump in our nervous system, is what's called the fight or flight system. And this is something that we share with our mammalian ancestors. So in the fight or flight, our heart rate increases, our respiration increases, blood flow is directed out to our muscles to allow us to either fight or flee. And then the last system, this is called the social engagement system, and this uses the myelinated, or the ventral vagal pathway. And this social engagement system is primarily a parasympathetic activity in the body. So when we're relaxed, when we're in parasympathetic activity, that actually helps to stimulate the social engagement system so that we can connect with other people, we can connect with our environment around us, we feel relaxed and calm. And what can happen a lot of the times is that we're either stuck in parasympathetic, or that we're either stuck in sympathetic, or we're stuck in the freeze mode, in the shutdown mode. And not only does it have implications for our cognitive functioning and our physical health, but also socially as well. So given that context, if we think about kind of the core deficits of autism, we know that there are sort of two main criteria. And one of them is restricted interests and repetitive behaviors. The other one is impairments in social communication. But sort of the features that we see around that, the characteristics, are difficulties with emotion regulation, difficulties with executive functioning, and also comorbid things like anxiety and sometimes even bipolar disorder or psychosis. And so the way that Porges understood autism is that there's something happening, there's something wrong happening in the vagal pathway, right? And so the vagus not only has these connections with the visceral organs in the body, but it also has these projections up into the brain, into centers of the brain that are involved in social emotional behavior. So it's connected to the amygdala, to the insula, to the anterior cingulate cortex, to the orbital frontal cortex, and all of these regions play a role in social emotional processing, and they also play a role in regulating the autonomic nervous system. So there's these certain nodes and they have these overlapping functions in the brain. So this is also referred to as the central autonomic network in the brain. And so what Porges and others have sort of theorized is that if there's kind of a global dysregulation happening in the autonomic nervous system, the vagus nerve isn't regulating autonomic activity properly, then this can actually have a bottom-up effect on the development of social emotional networks in the brain. So if we're really dysregulated, if I'm in sympathetic or freeze mode, it makes sense that I'm not going to be able to connect with others socially. So what happens is that when we practice exercises or engage in behaviors that help to stimulate parasympathetic activity, this can actually have a positive bottom-up effect on these social emotional brain networks that allow us to regulate our emotions, to pay attention, and to connect with others socially. So, how exactly do we practice diaphragmatic breathing? So I will demonstrate how we practice, and this is how I typically will teach my patients and families that I work with, but you can find a way that works for you. So I like to put one hand on my belly and one hand on my chest. And first, just noticing your natural breathing patterns. And then we want to see if we can breathe so that the hand on the belly goes up and down instead of the hand on the chest. And we want to continue to practice like this for at least 5 minutes at a time. I usually recommend 10 to 20 minutes a day of practicing belly breathing. And this is a really difficult thing to do, even for adults. We haven't practiced breathing like this in a long time, and so it takes time to strengthen our ability to use the diaphragm muscle to breathe this way. So in time, it usually becomes easier to practice. And a nice, little trick to use with children or adolescents or even adults is to have them place something on their belly. So they can place like a stuffed animal on their belly or another object and see if they can make that object go up and down with their breathing. So on the inhale, the belly's going to expand, the object will rise up, and on the exhale, the belly's going to contract. And they can see if they can sort of rock the object or the stuffed animal to sleep. There are also many apps out there that you can use. You can type in Breath Pacer into your app store and look for different apps that can help to pace the breath. I recommend starting at about 6 breaths per minute. So this is about 4 or 5 seconds on the inhale, and then you want to see if you can make the exhales longer. So about 6 seconds on the exhale, and that'll put you right around 6 breaths per minute. And working with kids with autism, whether you're a parent or a therapist, you probably know that using positive reinforcement can be really helpful. So you can use the same skills and background that you have in applying this technique as you do other behaviors. So definitely find something that's reinforcing, and if the child can practice for a minute, fantastic. Reinforce that. Provide access to something that is enjoyable for them. or maybe even just taking a couple breaths like that. And with practice, it usually gets a little bit easier. And if you're interested in expanding on this work, you might search for a biofeedback therapist in your area who practices this type of biofeedback. This is often referred to as heart rate variability biofeedback.